Good morning. Thank you for being here and welcome to National Public Health Week. Yay! My name is Carmen Valdez and I'm a professor at the UT School of Public Health San Antonio and also the Associate Dean of Research and Partnerships. And it is my pleasure to welcome you to this kickoff event. And we will start by talking about our school briefly. You can scan the QR code to learn more about the school's mission and history. I will just say that our school aims to promote health and well-being for all residents in the places where they live, work, play, and pray. And we do that by providing scientific training, hands-on education, leadership development to prepare future public health professionals, but also our collaborative research and service strive to conduct the type of work that really matters to our communities. The theme for this week's celebrations is, it starts here, the power of local partnerships. And what we are trying to do, as you can see from our events starting tomorrow and into Saturday, is that we want to showcase successful partnerships, also want to examine challenges that partnerships often face, and envision a path moving forward. We are not only today, we're going to be focusing on healthcare delivery system partnerships. Tomorrow, it will focus on the private sector community partnerships. And then later in the week, we will be focusing more on partnerships with residents themselves and the community at large. We also want to acknowledge that this week is National Graduate Student Appreciation Week. So on Wednesday, we have an event focused on student leadership and also mindfulness and self-care. Today we will begin with opening remarks from the president of the University of Texas at San Antonio, Dr. Taylor Eighmy. We will then ask Dr. Andrea Guerrero, who is the director of Bexar County Public Health, to come up and say a few words about a collaboration between our school, her office, and the Honorable Peter Sakai. And we will move on to the main part of this event, which is a panel discussion titled Delivering Healthcare Services While Improving Public Health, Contradictory Goals or Synergistic Objectives. But it is my honor to welcome Dr. Taylor Eighmy to the stage.
Good morning, everybody. It's a real pleasure to be here for a whole bunch of reasons. Public health is needed now more than ever, and the fact that we're celebrating Public Health Week is really important. I'll also share that from an academic, scholarly perspective, my background is as an environmental engineer, and so I used to spend a lot of time working on the persistence, fate, and transformation of chlorinated solvents in groundwater, which is an obvious, if consumed, is an obvious public health impact. So spent a lot of time in my life out in the field understanding why chlorinated solvents would be taken up by microbes living in the subsurface and how they were transformed and what microbial consortia were involved in those transformations. So I have a deep and abiding connection as an environmental engineer to clean water, clean air, clean soil, and those impacts of not having the right levels of environmental quality and how that impacts our communities. So it's something that's very near and dear to me. So I would almost say I know enough about public health to be dangerous in a good way, So I'm Taylor Eighmy, and I proudly serve as the acting president of UT Health San Antonio and the president of UTSA. And I will share this too. One of the first things I did when I arrived here in September 2017 was work with Dr. Henrich around this idea of creating a joint school of public health. It was something that seemed intuitive and obvious to me when I arrived. I even talked about it during my interview process when I was a candidate to be the president here. And so Bill and I bonded instantaneously around it. It took time and effort and some politics for it to eventually come to fruition. But the fact that I am here today reflecting our joint interest in this, I know Bill obviously can't be here, but he would be deeply appreciative of the fact that we're celebrating the Joint School of Public Health this week when public health is needed so desperately these days. So I think Bill would be pleased that we're getting a chance to do this today. And so I recognize his interest in our collaboration and working to bring the Joint School of Public Health together. And you know this, and I'm speaking to obvious things, but the University of Texas School of Public Health San Antonio is a transformative initiative addressing critical public health challenges in San Antonio and throughout South Texas because we have our very own unique public health challenges in South Texas. As a collaboration between UT Health San Antonio and UTSA, the school is dedicated to improving health outcomes for all, increasing access to health services, and building a skilled public health workforce. I also want to just give a shout out to the outstanding leadership of the school's founding dean, Dr. Vasan Ramachandran, and the work of his incredible team. We've made impressive strides to all of these goals. Dr. Ramachandran's leadership in various aspects of public health and medicine, paired with his nationally recognized contributions to research, has inspired teams within the school and throughout both our universities to continually strive for excellence. And if I don't do anything else today that's good and important, let us do this by celebrating National Public Health Week and the School of Public Health by giving Dr. Ramachandran, if you're involved with the School of Public Health in any way, please stand up. See? Vasan, 3 years ago, who would have thought all of these people would be here attending who are part of the School of Public Health? It's very, very powerful. Sorry, Vasan, I couldn't help myself. I just needed to make everybody stand up and be recognized. So I'd like to highlight a few things that are points of pride for our new Joint School of Public Health. It was obviously established to be a hub for public health in San Antonio and South Texas. It's the first dedicated school of public health in San Antonio addressing regional and national health challenges. It includes a 38-county service area in South Texas, among the fastest growing population-wise in the United States. And as we've discussed already, it has important strategic partners, including Bexar County, the City of San Antonio Metropolitan Health District, congressional, state legislative, and philanthropic interests that are very supportive of the enterprise. And those are all valuable, valuable partners. It also has an enhanced economic and workforce development role for the public health arena in this part of Texas. The School of Public Health is projected to create 100 new jobs and generating at least $20 million in annual research funding. It strengthens San Antonio's $44 billion healthcare and biosciences sector. By educating the next generation of public health professionals, the school ensures a sustainable workforce capable of developing and implementing effective public health policies. It has also driven public health innovation, which is really important these days. It increases access to health care to reduce health gaps in rural and South Texas. It's developing science-based public policy and provide models that support improved national public health trends. And it's integrating public health with healthcare, biomedical research, social sciences, and it's fostering interdisciplinary solutions that holistically address public health issues. And if you think about this notion that education is one of the greatest public health initiatives that we know of, it drives personal growth, personal trajectories that directly impact an individual and a family's public health status. The integration of public health across our merged institution as we go forward is a powerful, powerful, powerful construct. It should be embedded in everything that we do. The School of Public Health should become ginormous. Ginormous, that's my word. Sometimes I make up words. So this innovation aspect is just really, really, really important. And then it's really important, especially given the topic of the day, about recognizing our strategic partnerships. And so first, I'd like to recognize our colleague and advocate, Bexar County Judge Peter Sakai. Although Judge Sakai can't be with us today, his colleague, Bexar County Public Health Director, Dr. Andrea Guerrero, is here with us. Andrea, thank you for being here on behalf of the county. We deeply appreciate everything that we get to do with Bexar County, especially in the public health space. Our partnerships with Bexar County and University Health System have been especially integral as we've worked to transform healthcare with a top-tiered integrated health delivery system with growing services and academic and research programming to better serve our community. We're also very proud of this joint endeavor and look forward to continuing to find innovative ways to serve our community through our School of Public Health and our comprehensive, accessible, high-quality patient and medical education focuses. Second, I'd also like to recognize a very important person who is a huge champion for what we do and for our School of Public Health, and that is State Senator Donna Campbell. Senator Campbell has been an incredible advocate for our School of Public Health and has been the principal architect for a $20 million special item rider that is supporting the School of Public Health, and it's still very alive and well in this legislative session. And Senator Campbell's District Director, Joyce Yanuzzi, is here with us. Joyce, would you stand up so we can give you a shout out? I do know that the senator is deeply, deeply committed to supporting the Joint School of Public Health. She texts me questions all the time saying, Taylor, what's going on with this? What's going on with that? And we keep her apprised, and we're just very grateful for her championing what we're doing with the Joint School of Public Health. So Joyce, please, on behalf of all of us here today, please take our gratitude back to Senator Campbell and share that with her. So thank you. Okay, finally, there's someone else I want to recognize, and that is our very own Congressman Joaquin Castro. Congressman Castro has been a wonderful advocate for the School of Public Health. Through the community-funded project appropriation in fiscal year 23, he supported the University of Texas School of Public Health San Antonio with a $1 million award for renovation of facilities, and that was a very powerful contribution to hitting the ground running with the School of Public Health. Two of his staff are here today with a congressional recognition statement, and I'm going to invite up the two staffers who are both constituent services reps, Ray Salinas and Diego Ferrari. Both of them, by the way, are roadrunners now working for Congressman Castro. So we're going to do a little picture here. Come on over this way. And what I'd like to do is ask Dr. Ramachandran to come up and join us, and we're going to take a picture with this resolution. Do you want to summarize the resolution?
Yes, certainly.
You can even read it if you want to.
I'll summarize it.
Summarize it? Come on up.
President Eighmy. It's
Someone else can take a picture. Here.
yeah. In recognition of National Public Health Week and the UT Health School of Public Health San Antonio, Honorable Joaquin Castro of Texas in the House of Representatives.
So very good. Let's get a picture of Vasan. Come on up. This is your baby. Vasan. Vasan, I'm behind you again. I'm always behind you. Very good. Thank you, everybody. You know, I have to digress for a second. It tells you a lot about the world when you have roadrunners working in Congress, and you have in the last administration, we had 4 roadrunner graduates working in the White House. So that tells you a lot about the world. So we're very proud of those kinds of things. All right, so to reiterate, our partnerships with our community are immensely valuable to us across our entire institution, but especially in our Joint School of Public Health. And so we want to thank Judge Sakai in Bexar County. We want to thank Senator Donna Campbell, and we want to thank Congressman Joaquin Castro and their staffs for all the things that they do for us. So let's give them all a big shout out. In closing, as UT Health San Antonio and UTSA approach day one of merger, These efforts around advancing public health will only be further enhanced if you think about the role that education has in driving public health and addressing health disparities. All of this focus will turn our attention to world-class patient care, education, research, and service to benefit the community that we are situated in, because that is our fundamental purpose, is benefit of our community and the people that live here. We are here for the people of San Antonio, Bexar County, South Texas, Texas, the nation, and the world. So thank you all. Have a great, great meeting. Vasan, have fun with the conversation in the panel. I appreciate you very much. Let's go forth and crush it. I'm sorry I can't stay, but have a good meeting.
Thank you so much for those inspirational words. Very exciting. We move on now to Dr. Andrea Guerrero, who will make an announcement about a collaboration with our school.
No. Most people here know me, right? Yeah. She's like, do you want me to say a few words? No. Yeah, I look out and I am Dr. Andrea Guerrero. I'm the Director of Public Health. I'm used to saying that at court. For the record, sir, commissioners, I'm Dr. Andrea Guerrero, for the record. But yeah, I look out here and I see a lot of people that are familiar faces, people I work with every day. Our public health team is here, people I work with on special projects, people I've worked with for years and years on ACA, my Central Med peeps are here. So many faculty. How many of you are students? Are there students here? Yay. And it's one of the reasons I love coming to the School of Public Health is because more than 25 years ago, I decided to do a master's degree in public health, not really quite understanding what it was, and it changed my life, and would have never thought that I would have the satisfaction that I've gotten from a career, a job, but really a really fulfilling part of my life now. So thank you all for being here. Judge Sakai is very sorry that he couldn't be here, but the job of a county judge is really complicated and busy, and so, but his staff are here. Jim Lefkoe, his chief of communications, is here, and he wanted me all to talk to you about about the pride and the honor that it is to partner with the School of Public Health so closely. The health of our citizens is a top priority for Bexar County, for the county judge, and for the commissioner's court. And because of that commitment, they actually created the Department of Public Health at Bexar County in 2022, specifically to meet the needs of the county that were illuminated after the pandemic. And so one of the very first things that happened when Judge Sakai and Dr. Ramachandran started in their roles was they had a meeting and they said, we really want this to be a strong, formal partnership. And one of the first directives or ideas that they had and directed staff to start to plan for was to create a public health summit to bring together folks like you brilliant folks in this room, those who aren't in this room, and especially our community that we serve, to talk about community-driven strategies. How do we learn the lessons of the last several years? How do we endure some of the challenges that we are facing right now? And bring folks together in the spirit of problem solving and sharing and creating best practices and evidence-based programs. And so the Public Health Summit was born. And so far, over the last several months, it's just been the University of Texas School of Public Health and Bexar County, but our intent is to tap into the brilliance of a lot of minds in this room, and especially our partners at University Health System, City of San Antonio, Metro Health, and all of you that are interested in steering this ship toward that sharing space and to create that environment where public health is not just something that we do when it's a crisis, but it's something that we do every day, because of course we do, right? That is the announcement that we wanted to make today, is to formally announce that this will happen next April, tentatively planned. Of course, it's a year away, for April 10th and 11th. We are hoping that we will confirm that it will be at the Tobin Center. And when we get that confirmation, we'll actually print that somewhere. But right now it's still being approved. But we hope that you'll all join us. And I think the elephant in the room is that there are a lot of challenges. There's a lot of uncertainty. And a lot of our community members are frankly scared. And so what I like to say is that to my staff, that we talk about guardrails around public policy. And who are the guardrails? I'm not the last guardrail. Maybe you're not the last guardrail, but together we can create some guardrails around how to do some harm reduction in what we're having to deal with. So thank you all for your continued work. I know the judge thanks you. Commissioners Court is fully committed to this partnership, and we're very honored to do this with you today. Thank you.
Thank you very much, and we look forward to working with you over the coming months to plan for this community-driven strategies event. I would like to invite the moderators and panelists to come to the front. First, Dr. Vasan Ramachandran, who is the Dean of the UT School of Public Health San Antonio, and Dr. Michael Halpern, who is the Chair of the Department of Health Policy and Health Services Administration. Our distinguished panelists are Dr. Ramon Cancino is the Executive Director of the UT Health Physicians Primary Care Centers and Senior Medical Director of Medical Management. He has a degree in medicine from Northeast Ohio Medical University, and he oversees 7 primary care locations delivering patient-centered, team-based care to the diverse population of San Antonio and South Texas. He also manages cancer prevention and screening activities at UT Health San Antonio. Dr. Carol Huber is the Vice President for the Institute for Public Health at University Health System. She has a public health doctorate from UT Health Houston and an MBA from UTSA. And she is, or as an executive leader, she champions University Health's commitment to promoting health, preventing disease, and prolonging life in Bexar County through programs, services, and partnerships. Next, Dr. Carlos Moreno. Dr. Moreno is the Vice President and Chief Clinical Officer of Communicare Health Centers. He has a medical degree from Universidad del Este in the Dominican Republic and an MBA in Healthcare Administration and Management from UTSA. And he's an accomplished bilingual professional with over 27 years' experience in the fields of biomedical research development, academia, and healthcare administration. Last but not least, Dr. Lisa Ochoa. Dr. Lisa Ochoa is the president and vascular surgeon at San Antonio Vascular and Endovascular Clinic, also known as SAVE. She has an MD from Baylor College of Medicine and is a certified through the American Board of Surgery. She has partnered with hospitals, managed care organizations, universities, nonprofit organizations, local school districts, city council districts, and clinicians of all kinds to develop amputation prevention programs, awareness platforms, and additional resources. Join me in welcoming our panelists.
Good morning. Morning. I want to recognize all the students, fellows, or residents who are in the audience, and just want to contextualize why we are having this panel. The title of this panel, as you know, is Delivering Healthcare Service While Improving Public Health. Contradictory goals or synergistic objectives. So one wonders, where is the controversy over here? I think there are a couple of concepts for the students in the audience. One is something we call as the dance of the Red Queen. For those who have read Through the Looking Glass, Alice, this is by Lewis Carroll, she is running hard to stay in the same place. And the dance of the Red Queen is often used to introduce an evolutionary concept we call as co-evolution, or rather, where people are not competing, but they co-evolve together. In fact, such was the background of public health and medicine. If you rewind the clock, go back to the 1890s, social medicine was right there. And famous people like Émile Durkheim spoke about how medicine and the social basis of disease, they are linked together. Somewhere along the line in the early 1900s, they split. And public health went on one side and medicine went on the other side. Classically, this was evident in the campus of Johns Hopkins, where there's supposed to be a street, and on either side you have the School of Medicine, the School of Public Health. It's called the famous street because the two buildings don't talk to each other, apparently in contradiction. So that's the theme of this panel. We are very fortunate to have some leading people involved in healthcare right over here. And they also wear a public health hat. So I'm going to start off this discussion by going around and having each one of our panelists talk about, in terms of healthcare, which organization do they represent, which demographic do they serve, and what does it mean for them personally to lead their healthcare organization right here in San Antonio. And I'll have Dr. Marino start us off.
Thank you. Thank you. And thank you to all. It's an honor to be here and to share with you. I am very privileged in serving as the Chief Clinical Officer for a federally qualified health center here in San Antonio. CommuniCare has been an institution for the past 53 years, serving Bexar County, Kendall County, and Hayes County. We have 34 sites, over 130,000 patients. And in this service, our primary care service focus is placing us in the most medically underserved health professional shortage areas. That's where, if you know, your MUA and your HPSA scores come from. So based on this, we are focused on quality outcomes. And to share a little bit about federally qualified health centers, there's 77 in Texas. 1 in 17 Texans uses an FQHC for their primary care service. And we serve over 1.8 million Texans that generate 6.7 million visits a year. Federally qualified health centers have been around about 60 years, and they serve 10% of the U.S. population. That's 34 million Americans. And so as a primary care provider, our integrated services rely on working collaboratively with our hospitals, with the health department, and with all community partners, because the closer we are with the community, the more the community is aware we exist, their services are available. We turn no one away for their ability to seek healthcare services. We're not a free clinic. There's a sliding fee scale. We adjust that in accordance to an individual's income or a family's income. And our service is there to be preventive on the primary care side. And so CommuniCare has taken a very unique stance in the past 10 years that I've been in this leadership role. And we've brought specialists in-house, 14 divisions, so that we can move our patients up faster and prevent chronic conditions from becoming even worse. So our collaboration with the university has expanded over the years, and we're very, very proud of the services that we provide to the community.
What does it mean for you to serve in San Antonio?
To serve, it's an honor. Number one, it is an ability to go beyond what most oftentimes we see as service, right? Most oftentimes we think of one-on-one. If you can save, it was very unique to me. I was up at the University of Michigan. I was in Michigan for many years, and I was in New York. One friend, one night when I was in Michigan, his son was ill next door. And I was a knock at 3 o'clock in the morning. The child was with fever. He came up. I took care of him and sent him to the hospital. And I said, it's kind of unique why he put me. He goes, if there's anything you can take away from them, and he was a minister. He says, sometimes you have to look at, maybe you were placed in a particular place to make a difference. And your whole purpose the entire life was just to be there for my son. That's what it means.
Thank you.
Thank you.
Dr. Huber.
Hi, thank you for having me. I work for University Health. We are the Bexar County Hospital District, and we serve all the people of Bexar County with our aim to provide high-quality, compassionate care. We do everything from primary and preventive care. We have over 50 facilities across the county, including school-based clinics and mobile units, and we also have 2 hospitals here in the medical center, and we're so excited to be expanding and building a hospital down across the street from A&M San Antonio on the south side and Retama on the north side. We have so many programs and services and centers to name today, but we are a level 1 trauma center. We have an amazing CareLink program, which is a financial assistance program to make healthcare more affordable for our most underserved members of the community. And we most recently launched the Institute for Public Health, which I lead, which really serves as a hub to connect our internal teams with our external partners to improve the health of the community. As a leader, it's such an honor to be here to serve not only the patients, the community, but also, as a faculty member to mentor students, to advise them, and to really lead the newest generation of public health professionals. I think the favorite part of my job is being a connector, and having been in the community for nearly 30 years, I've had just the pleasure of getting to know a lot of different people and working with folks, and now I can connect them to each other in new and exciting ways so that we can really get more done. So I'm really excited to be here with you today.
Thank you. Dr. Cancino.
Great. Thanks for having me today. So I'm Ramon Cancino. I'm a family medicine physician. I'm the executive director of our primary care center, which sits within UT Health San Antonio. UT Health has had, gets about 2.5 million visits per year. The primary care center represents about 3,000 visits per week as part of that 2.5 million visits. When I first came here, we had 3 primary care locations, and since then, we have grown to expand our services for our patient population here. And as part of an academic health center that's thriving, in addition to what the other speakers have said, we really focus on educating future leaders in primary care. By 2032, there's going to be a gap of about 40,000 primary care doctors for Texans. And it is, we see, part of our responsibility to train future leaders in healthcare, but also future primary care physicians who not only train here in Texas and in San Antonio, but stay here in Texas and in San Antonio. To us, that's really important. To do that, we focus on the wellness of our clinicians as well as the whole person care of our patients. All of our primary care centers are NCQA recognized patient-centered medical homes, which means we focus on surrounding each individual patient with the care that they need, and that's how we treat them. And so what it means to be a leader here in San Antonio, we love San Antonio. We want San Antonio to be nationally recognized for the healthcare we deliver and for the improvement in health that we give to our patients. For us, that's really important, and I'm very honored to be in this group as well.
Thank you. Dr. Ochoa.
Hello, good morning. So I'm Dr. Elisa Ochoa, and I have to say, all of y'all are probably thinking, which one is like the oddball in the panel, right? So I'm a very specialized surgeon. I'm a vascular surgeon in San Antonio. I opened my private practice in 2018 called the SAFE Clinic. And the reason I started that clinic is because I observed the health disparities in San Antonio, and specifically to vascular surgery. I noticed that diabetic amputations were a lot higher in the zip codes on the south side, near east side, near west side. And I wanted SAFE to be that vehicle where we take the care to where their patients are. We have 9 clinics across South, West, and East San Antonio. We go to 2 rural areas south of San Antonio. We want to deliver quality vascular care to finally address the fact that they're not getting the care that they need and prevent amputations. So that's what I wanted to do as a vascular surgeon. But you here in public health probably know what it took me a while to figure out. And that's that if I'm going to try to influence health disparities, amputations, that we have to address the social or non-medical drivers of health. And that's when I learned that I need to be a bigger part of my community than simply just a direct medical care. And that's where my dive into the world of public health and recognizing that even as specialized as a vascular surgeon, we need to collaborate with our public health partners if we want real change for our population. And so for me, what it means to be a leader is that it allows me the opportunity to fulfill my obligation to my community, to a population that looks like where I came from. I'm from the Rio Grande Valley, that has similar statistics to the south side of San Antonio. And I've been given an opportunity to go down a path of medicine as a surgeon and a leader on the south side. And this is my opportunity to fulfill that obligation back to my community, back to my people, and hopefully impart change, something better. And so some people say it's hard. We mentioned there's lots of challenges. There's a lot of hurdles. And I get that. But no one's going to say we didn't try. So, thank you.
Thank you. Excellent. I'm feeling warm all inside, but we'll go around the other way and Dr. Halpern will ask questions. So we'll keep going around in circles.
All right, thank you. Can you hear me okay? Thank you. Well, diving into the theme of this panel, there may be differing priorities or considerations in delivering optimal healthcare services for individuals or patients versus providing high-quality population-level healthcare and improving public health. So how do you balance competing and sometimes contradictory demands in providing individual-level versus population services? And how do you think about allocating personnel and other resources and focusing on different outcome measures for individuals versus populations?
That's a great question, especially for a vascular surgeon. All right. So as a vascular surgeon first, I have to focus on the direct patient care. But I'm going to tell you the first few steps we took in our office. I recognize that if I wanted my patients to do well, after I do a bypass or an angiogram and stents, that I can't send them home, expect them to eat the healthy diet I tell them to eat, do the walking in their neighborhood that I told them to take their medications, their statin, their antiplatelet, and I'm sure you're all looking at me with that look like, what is that? And that's health literacy. And so I began to dedicate literally all my staff and train my staff through Health Confianza, who is a partner here, and understanding that they have a role in patient education, in helping patients understand why they need to do what they need to do, and helping them get transportation to my office. I'm going to tell you that's the biggest hurdle for most of my patients to get the specialized care that we give, and giving them resources to how to get food, transportation, saws. And so we actually have another partner, which I know all of y'all have heard of, the Health Collaborative. And they have members of their organization sit in our office, and those patients that we see and we identify they have other needs, we are able to partner with them and they help them with those resources. And so whereas I do have some personnel in-house to help me with the public health part of it and the other aspects, I've collaborated with organizations that are doing it already and bring them into our office. And this is how we work together. The other part that I have realized that we are doing at the SAFE Clinic in the south side of San Antonio is that we recognize that direct medical care alone is not going to be the solution to these chronic illnesses and complications. And so we just started a nonprofit called CHEST in South San Antonio, and it's a multi-collaborative, multi-sector entity that brings together housing, environment, transportation, education, workforce development, public health, and healthcare leaders to figure out how we work together to address finally the fact that lifespan varies over 20 years north of south of San Antonio. And so we're bringing a whole new board for that. And for my personal investment to help me strategize all this, I've actually hired a friend who I've known since high school, and her name is Sandra Gonzalez. She's over there. And she is helping me figure out how I coordinate my schedule between patient care. I just finished 2 angios this morning, and she drove me over here to make it for the panel and make sure that we keep those priorities aligned, the direct patient care and the public health.
Similar to Dr. Ochoa, I think, some of the best ideas and interventions that I've been able to have and implement in my role has really come from these individual interactions we have with patients. One of the things that I noticed in my patient population here in San Antonio is when I have conversations with male patients about colorectal cancer screening, you sort of get that face like, do I need that? Do I want to know? I'll think about it. And I started to see a theme about that. Many of my male patients were hesitant to get colorectal cancer screening. And we know if we find colorectal cancer or signs of it earlier, we can keep that patient from dying of cancer. So I brought that question back to our team, and we looked at the data. And the data showed our male colorectal cancer screening rate was less than our female colorectal cancer screening rate. In fact, when you look at males living in certain zip codes in San Antonio, their screening rate was even worse. And this is a national problem. And so to answer your question, Dr. Halpern, often we use sort of that individual meeting with a patient to really think about the population level questions we should go after. And we did. We worked with Amelie Ramirez, who has a Vasan American Cancer Society funded center here. And now we have an American Cancer Society funded grant to help male patients living in areas of persistent poverty get colorectal cancer screening if they're due. And not only that, we're looking at community health workers and their impact on that patient population. So we need to use the data that we have in our population, but a lot of these questions are really coming from conversations we're having with patients. And that too, right? There are reasons our patients may not want to get certain cancer screenings. And so those conversations with patients really matter. And so while we might make population level decisions in our organization, it is still that meeting one-on-one privately with a patient that is going to make a difference at the end of the day.
I'm going to echo a little bit of what you've already heard. As University Health, we are clearly a healthcare provider first and foremost. And so that direct patient care is a priority for us. But we also know and understand that health doesn't happen in a vacuum, right? That the factors, the context, the environment in which people live, work, play, and pray really has such a huge influence on that. And I think that's why I know that's why we launched the Institute for Public Health. But this isn't the first time that University Health is tiptoeing into public health. We've been around for 100 years. I've been there for 27 and started as a health educator, being out in the community, teaching people about healthy eating and exercise and all the things that are required to prevent or manage diabetes. But we also know we can't do it alone, that we are one of many. I had two great mentors over the years. One would remind us that, no margin, no mission. And the other one would say, nonprofit is our tax status and not our goal. So we can't do things that aren't sustainable, right? Or that aren't, something that can be funded in a way that won't negatively impact our solvency. And so how we go about doing that is really important. And we do that through partnership. And so we're really excited about our University Health Vita that's opening up at the end of the year. It's a new multi-specialty clinic on the south side across from A&M San Antonio. We're going to have physical health services, behavioral health services. It's going to be home to the Institute for Public Health, but it's also going to have a lot of community spaces, classrooms, a teaching kitchen, an outdoor lawn, a place for mobile units to pull up and connect. It's also going to have a office suite on the second floor that we're calling Community Commons. And we're going to invite other organizations, particularly nonprofits, to come and sort of co-work with us. Think of it as an innovation hub or an incubation hub where we can really work together with each other, or these partners can go down to the first floor and help navigate our patients to the services that they need. So we're really excited about this model. We're going to have an event on May 15th. So if you're an organization who would like to learn more about this model and this process and how you can share your interest in working with us in that way, please be sure and see me before the end of the day, because I'd love to see you at that event.
Yeah, thank you. Clay.
Well, in healthcare, we should eliminate the word competing and more collaboration. There will never be enough hospitals, clinics, or doctors or caretakers that could handle the world population. There's no way. So with that, the way community care has taken a change in terms of from primary care services in focusing on quality outcomes. If we can, it's amazing that 60%, right, or 80% of our patients are healthy. 80% of our patients, 2.5 visits a year. Yet it's 20% of our patient population that uses 60% of all the resources, right, because of chronicity. So what we have been trying to change is that modality, because we've brought on in-house specialists to move our patients faster through and not have to wait 3, 4, 5 months for a neurologist or a rheumatologist. And we work very collaboratively with the university because sometimes they're overwhelmed and said, can you take a couple of our patients over in that collaboration? And we've opened up resources for expediting and preventing a chronic condition from getting to the worst. And as Dr. Ochoa has said, you know, our prevention here in San Antonio held one of not a distinct honor. It's very sad that we have one of the highest below the knee amputations in the nation. 1 in 6 San Antonians is pre-diabetic. So because we're trying to work on the prevention and education, we have every single day, at least the community care, we're adapting to the changes that are forthcoming and trying to adapt on the prevention side.
Yeah.
Our Northwest campus right now on Callahan, apparently there was a very high influx of Afghan families that were relocated to San Antonio.
Yeah.
Our Northwest campus no longer has Spanish as one of the primary care languages. We now have Pashto. The great majority of individuals there have no vaccines. We have a 17-year-old who's never seen a vaccine. We're starting him on a 24 vaccine cycle. Schistosomiasis parasites is now very common among the families, and we're treating that, and our docs are going, for the first time, parasitology is coming back to help me. The level of illiteracy, how do we communicate with them? So we came up with a new device based on pictures for their medications, a sun and a moon. You can take your pills in the morning. So we've used these abilities to now help other patients and adapt cohesively to education and for them to be compliant. So again, access is probably one of the most difficult things that most oftentimes patients and community are faced with, but we're all trying to create that access and to create that equality that every human being deserves. So, you know, the thing is, we're trying to change the stigma that the United States is about 34th in the world in quality, but number 1 in cost. That's a dynamic that we have to change.
So providing public health services in a healthcare delivery setting often involves thinking outside the box. So how does your healthcare delivery system integrate non-medical services as part of a broader public health framework? As Dr. Ochoa already mentioned, this could include assistance with transportation, housing, food insecurity, or other issues that might not traditionally be considered part of medical care.
So what has CommuniCare done? We've partnered with the San Antonio Food Bank. We've asked the San Antonio Food Bank brings a bus to 3 of our largest clinics. And so with that, we provide every single family member that comes in there with a voucher to go outside and pick fresh fruit, fresh food. And they in turn have brought a chef on board that in the bus that helps individuals try to change their mindset on how to eat healthy. One thing is to tell them, another thing is to show them. That's one. On the second part, trying to provide, we have care coordinators, we have dietitians, and we have health coaches to no extra cost to the patient. So when you have a health coach giving 6 sessions and giving them guidance, what does it mean what the dietitian just told me? That dietitian now he told me to eat healthy. What does that mean? Well, we're going to space out your food. We're going to have this much quantity. We're going to try to avoid anything, the rice, the pasta, the everything that may be harmful and you're unaware of. And that's been helping. And then last but not least, we have navigators. So that navigators Communicare cannot solve a child with asthma living in a mold-infested apartment. But what we can do is connect them with the San Antonio Housing Authority and say, if you make this application and move forward in these manners, you might be able to relocate and get your children out of that environment that's really causing their health conditions. So here again, we're using our partnerships. We're seeking other experts in the community and looking outside the box at AI technology. What else is out there? Our iPhones are so smart, but they're only as smart as we use them. So it's, again, guiding and educating the community to the resources that we have.
So University Health, like all things, we have a multi-pronged approach to this question, trying to align our strategies to meet people where they are. The first thing we're doing is educating our staff and our teams, our providers, so that everyone understands the role of non-medical drivers of health and the impact that it has on a patient's health outcomes. It helps us to provide a more compassionate care to the patients that we serve. We are also trying to improve how we screen and refer patients. We are a large system, and so we have the great opportunity to test new things in different ways, and who's doing the screening and how are we asking the questions, and when is the right time to ask those questions. And so we're learning a lot from that so that we can standardize that over time. But we also don't want to screen without having a way to help the patient. So who are our partners? How do we make those referrals more effective through using Epic and Epic Link, which is an electronic platform in our EMR? But then also making sure that we're, closing the loop and the referrals are getting to the patient is getting to those social services that we know that can help them. We are also looking for ways to adjust our care delivery. So it's not just about screening and referral. It's how can we do things differently? Is telemedicine a better option for people who may have transportation issues? Or can we do more mail delivery of pharmacy rather than expecting people to come to us to get their medications? And then the last piece is really all about advocacy. Because again, we can't solve everyone's problem on our own. We have to be able to have partnerships, but we also have to find sustainable ways to fund this work and change policies, particularly within Medicaid, for how these things will be covered. And so I serve on the state's Texas Value-Based Payment Quality Improvement Advisory Committee. I've spent the last 4 years as chair, and we've put out 2 legislative reports with recommendations around this issue. We have a very specific subcommittee on non-medical drivers of health, but all of our subcommittees bring in these issues consistently because it just impacts everything that providers and health plans are dealing with on a regular basis. So we're really hopeful that our friends and colleagues in the legislative session can look at some of those recommendations that we've made and implement them or direct HSGC to look for ways to implement those ideas.
Yeah, similar to Dr. Huber, at UT Health Primary Care, we do a lot of training of our staff. In fact, 100% of our patients, because we're an NCQA patient-centered medical home, get screened for certain non-medical drivers of health as well. But asking the question is not enough. In fact, we need to proactively talk to these patients. And so I'm going to embarrass a few people here who are also, we have a number of our nurse care managers and our community health worker in the room now. The hospital readmission rate nationally is like 20%. In fact, it barely has budged in the last 10 years, despite everything we're doing as a nation to drive that down. There is some data that would suggest that patients over the age of 65, 1 out of 2 of patients over the age of 65 get readmitted to a hospital within 2 weeks of discharge. And think about the havoc that wreaks on families, hospital systems, patients, and oftentimes those readmissions could have been avoided. So we have a team that reaches out to our patients that are 65 and older as soon as they're discharged to try to navigate them back not only to their primary care physician, but to health, including their specialists, as well as any other community-based resources. And we track that data, you can ask them daily, because that's really what it takes. Because when patients get home and they don't know, they didn't understand their medications on discharge, they didn't know what to do next, it is very confusing. And oftentimes, and we know this, if any of your family members got admitted to the hospital, that day of discharge is one of the most confusing times in healthcare for a patient. You want to get home, you were just in the hospital, and you don't know what to do next. So we have to call those patients. They're not going to call us unless there's a problem, and ask them, let's go through your medications together. Are you safe at home? Do you have everything you need? And we connect those patients right then and there to the help that they need. This isn't special. This is what a lot of health systems across the countries do. But for us, these are folks that know these patients and they call them weekly. And I just want to thank our nurse care managers who are here in the room, led by Ms. Elisa Butler, because they are making a difference in the lives of our patients in this community.
Well, this is, I don't have much to add because I realize that I've learned a lot and been able to incorporate a lot of what they've said into my practice. And so, the way we address transportation is not just the fact that we pack into a 15-passenger van and 3 days a week we go out to these communities. I imagine it's easier for us to get to them than for them to get to us. And there's just one way. We work with their insurance companies, and there's nonprofits as well that can help with rideshare and help transport patients there. For health literacy, we've incorporated health confianza protocols and strategies into our office, but we actually, every single time I meet a patient, I talk to them about their diabetes, their A1C, their foot care, smoking cessation, ad nauseum, and they get handouts. And I know that's just a little bit, right? I'm not going to change someone's mind in one visit, but if they hear the same message from their primary care doctors and their specialists, I think that's how we begin to enact change and help improve their health literacy. Another part is just education of the community. Most people know that breast cancer and lung cancer, and they know what those statistics are. But most people don't know that peripheral arterial disease, it has a greater mortality than those two combined. Most people don't know what peripheral arterial disease is, who's at risk, and how do they get screened for that. Basically because most of them 66% of patients are asymptomatic. And I'll tell you one small project, well, maybe a large project, that we have started is here at UT Long School of Medicine. Several first-year medical students, some who are in this audience, came to my office and they said, we really want to do something to help our community. We want to be able to interact with the South Side, the underserved areas. We speak Spanish and we want to practice our medical Spanish. And so what can we do? And so already in my clinic, we have a community outreach coordinator, and we go to at least health fair once or twice a week every month. And I said, well, why don't you bring your students to my office? I'm going to educate you about peripheral arterial disease, diabetes, social determinants of health. I'll teach you how to do a very screening test called an ankle brachial index. And anytime we're at a fair, you can come join us and you can help us screen patients. So I had 20 5 medical students, first-year medical students, come to my office. And when the next day at the health fair, we had 3 or 4 of them show up. And we've had follow-ups after that. And I just learned that in the next week, they are actually going to have a meeting with the nursing school, the PA school, and all the allied health students so that they can now teach them how to do it and they can participate in educating our communities in these zip codes. And so what I'm going to tell you is the future of healthcare is bright. We have students that are medical students and in public health that care, and we just need to create the opportunities and the connections and collaborations to kind of give them that platform to be able to help our communities. And I'm so glad to hear about your advocacy, and I didn't realize you were in that role. And so I actually just proposed a resolution to the Texas Medical Association. And so if y'all have not been involved in organized medicine, especially the medical students, the TexMed of the TMA is going to be held here in San Antonio in May. And it's kind of where we have our own legislative session for medicine and where we propose resolutions to have policies that get proposed to the Texas legislature. And so my resolution was about Medicaid and Medicare parity for physicians who provide care in underserved and rural areas, because there's fewer and fewer physicians taking Medicaid, providing care for these underserved communities. And so how do we entice them and allow them to become sustainable? Because nonprofit is our tax exemption, not what our goal. And so we still need to be able to get those physicians to be able to have a viable financial practice to serve these populations. And so I ask you guys to be involved in the advocacy part also, because ultimately policy change is how we're going to be able to affect and influence our population health.
What you see over here is 4 healthcare leaders, several common approaches. I'm sure they spend 10 to 12-hour working days, if not longer, Lisa being a surgeon. But sometimes it feels as though you're on this treadmill and it's never ending. You keep doing the same thing, But most of the leadership positions you are in, it's about impact. So if you want to fast forward 5 to 10 years and you look at, say, UT Health Physicians, UHS or Communicare, and from your organization perspective, you want to pick 1 or 2 top priorities. I learned that if you have too many priorities, you have no priorities. So I'm trying to buttonhole you all artificially. I'm sure you've got lots of priorities. You have to pick, and we'll start with you, Lisa. You have to pick 2 or 3 priorities, 1 or 2 priorities for SAVE. What would it be?
So this is going to be a boring priority, but it's improve operations and workflow. We work on these processes in education, and it all sounds great, but anyone who oversees and trains staff realizes if you're going to start a new workflow, it's not like you just tell your staff one time and they got it. You have to repeat that workflow, figure out what the barriers are, rework them over again, retrain them over again. And so as we grow, I started off as a small had 8 employees and 1 doctor, and now I have 40 employees, 5 doctors, and we actually have the only Medicare accredited surgery center on the South Side that we're running as well. And so one main priority is how do we improve operations and workflow to deliver what I just told you, what our mission is, what our values are. That sounds boring and benign, but it is vitally important to get those, in place. Number 2 priority is I really would like to expand what SAVE is. So on the South Side of San Antonio, we have a central clinic, and right beside it is a surgery center. It is the only Medicare accredited surgery center on the South Side. And I built that surgery center not just so I can do vascular surgery, but we built it to have a place for proceduralists to come to the community and deliver that specialty care, whether it's podiatry, pain, ortho, GI. Part of the problem of being able to get screening colonoscopies for our patients who need screening is there's not enough places to be able to do colonoscopies. And so if I could bring GI to this area, that would be great. So expanding the accessibility of that surgery center, and maybe this is longer than 5 years, but with that is I had a dream that we put this small footprint of a clinic, multi-specialty clinic and a surgery center on the others of the near east side and near west side so that we're able to deliver this kind of care in patients and communities?
Thank you. Dr. Cancino.
It's a really great question. One of the big reasons I went into this field is because of my father. He passed away while I was a resident at Mayo Clinic of diabetes. He had multiple foot infections, multiple heart attacks, and, had a heart attack while he was in the hospital. And that's ultimately the event that took his life. I came from sort of a lower middle class family, and so his diabetes took us to great healthcare and not so great healthcare. And accessing that great healthcare was challenging for our family. And my mom was a nurse, we knew people. And so to answer your question, a big reason why I'm here is really to expand primary care. And that's one of my goals. 5 to 10 years from now, we really want to leverage the merging of UTSA and UT Health San Antonio to grow primary care here in Texas. And I'm talking about the primary care team, not just primary care physicians, but everyone else involved with primary care, from behavioral health to our nurse care managers to social workers, everyone in charge of keeping patients healthy so that we can tell patients on December 31st that they are healthier than they were on January 1st every single year of their life. So that's number one. Create a really clear workforce development process from UTSA all the way up and through graduation of residency. Number two is probably what everyone else here is thinking. We really need to make it so that it doesn't matter where you live in San Antonio. You have access to great care. We understand there's a divide between North and South in San Antonio, and some of that is systemic. Some of that is because of old decisions that were made. But we need to work together to ensure great access for care across the city. And, I think the right people are in this room to do that.
I think the short answer is diabetes, maternal health, and behavioral health for us, and access to care. But 5 to 10 years out in healthcare is really hard to predict. And I think the more important question for us is, how do we prepare to be prepared in 5 to 10 years? And how do we really strengthen that infrastructure? And how do we make decisions about what our priorities are and how to invest in them? We recently launched a health equity leadership team at University Health. It's an interdisciplinary team, really trying to understand, how do we make health disparities a priority? How do we make building our infrastructure, whether it's our data collection or our workforce, a priority? How do we work on our data collection and analysis and disaggregating so that we can understand the differences and the gaps in care for different populations, whether it be, age or gender or geography, right? And how do we then intervene with evidence-based practices so that we can truly, solve those solutions in partnership with our patients? And how do we work with our community to advance that work? So I think that's real important to us. We recently launched our Institute for Public Health website for the community, and a key part of that is to bring together a lot of community reports, because there's so much great work in the community to do needs assessments, to do implementation plans, strategic plans, and we want to leverage that and lean on that wisdom and expertise and data that our community has assembled and continues to look at to drive their work. And one of our most recent reports is on South Bexar County. Funded with funds from Congressman Castro, which we really appreciate. And we can, for the first time, not just look at Bexar County as a whole or just different zip codes, but saying, how does the south half of Bexar County compare to the overall Bexar County? And we really begin to see in black and white those disparities that we knew have always existed. And so I encourage anyone to look at that report and use that for grant funding or anything that might help you to make the case to sustain your work.
Dr. Moreno.
Well, a two-prong. The first one is sustainability. Though over the next few years, there's they're estimating approximately 700 rural hospitals will be closing. The great majority is financial reasons based on the fact that the reimbursements have stayed level for the past 20 years and healthcare costs keep rising. Healthcare among all the institutions and all businesses is 10 years behind all the other systems. Our CEO, Paul Wynn, loves his video because we have if you're an F1 Formula racing fanatic, he puts up in 1982 how long it took the pit crew to change tires, oil, and gasoline versus 2024. It was almost 35 seconds before everybody was crashing into each other. And you look at 2024, and they do it in 1.8 seconds. Gasoline, 4 tires, and move in and out. That's how he feels healthcare is right now in the 1982 model. So for CommuniCare, what we have looked at is the federal government provides $7.2 million to offset uncompensated care. What CommuniCare did last year, because as a 501c3, we reinvested our monies and gave over $16 million of uncompensated care back to our community. That's our commitment. And how do you do that? How do you do that? What we do is we try to think ahead. We brought an in-house pharmacy to bring medications directly to the patients so that our doctors can say, I see you received it, but what happened now? We made it cost-effective. We use a 340B program. We bring it to your home. I can't tuck you in and put the pill in your mouth. That's the last thing I would need, right? So sustainability is right now the insurance companies are finally recognizing that if we can really keep our patients healthy, there's a cost savings and they can pass that on, making you work smarter, not harder. One. So that's the long part. My part is to create my succession plan for the next 5 years, because in 5 years, I'm out. I've done 42 years right now of medicine, and I think it's enough. So our part is we collaborate with the University in Incarnate Words School of Medicine, and we are creating the feeder source for our depletion that's going to occur by 2035. We're going to be about 150,000 physicians short. Primary care, behavioral health, and geriatrics are going to be the top 3. And so we're trying to create a feeder source so that we can continue to provide providers access and continuity of care with the prevention, education, and resources that our community needs. So, thank you. Question? Sure.
So this has been a wonderful discussion. And based on the discussion and the insights that have been shared by your co-panelists, what are 3 takeaways for healthcare delivery systems regarding public health that you'd like to share for San Antonio and Bexar County?
1, collaboration. That's why we're all here. If you want to run fast, run alone, right? But if you want to run safe and get there in one piece, run as a team, right? So we are here for the long run, not for the short run. And if we're going to do this, it has to be systematic because not all of us are experts in every area. So let's take and not duplicate services. It's because some of us are better at some certain things than others, right? There's enough patient population that will serve enough patients and everybody will be sustainable. Number 2, I think it's to be prepared for the unexpected, all right? The more for us, we have removed as much dependence on grants because departments and services are predicated on those grants being alive. If the monies go away, the services go away, and the community is left like, what happened to it? Well, the money ran out. Look at what happened to Susan B. Komen, and then we had everything else that was very grant dependent. So if we can start providing the services that are self-sustaining for the long run, then we're better able to establish and give our community consistency. And I think the last one is be prepared for the unexpected that we don't know, which is healthcare right now is in an uncertainty, but we have to stay true to the course of what has made us and sustained us for over 200 years, right? And I think as long as we're all continue and everyone in here, your passion continues to drive you every single day while you get up to do what you do, I think that'll give our communities the safe harbor that they deserve.
Those who work with me a lot know my favorite saying is you have to have a high tolerance for ambiguity. Being flexible, being open to what might happen next. We just don't know. We don't know all the rules. We don't know what all the guardrails are sometimes. And we just have to be flexible and ready to take on whatever comes to us. The other thing is, we hear the phrase, it takes a village to raise a child, but what does it take to raise a village? And, who needs to be in the room at the table to come together in that collaborative effort to solve these major multi-generational problems that we're facing? And that includes bringing in the people we don't often think about. One thing that drives me crazy a lot of times is we talk about issues like non-medical drivers of health, but we talk about them to people who already know what that is. How do we find those people who don't know what that is, but impacts their businesses, impacts their hiring practices, impacts their students' ability to go to school? And so how do we engage them in the conversation, the business community, the philanthropic communities, all of those different folks, to be sure that we're having a very meaningful discussion with other people who can contribute to the solution? And then along those lines, I think it's this interdisciplinary approach that's key. I really love seeing students who, that if you get a bachelor's in public health, you don't just have to get a master's in public health. Go get an MBA, or vice versa, because having a business side of healthcare and the public health side of healthcare really makes for stronger employees who can really see the bigger picture when we talk about things everywhere from non-medical drivers of health to sustainability to financial payment systems to government relations and all of the things that go into solving these issues. So, whether it's seeing more healthcare administration degrees embedded in public health schools or dual MBA and PhD programs, I think those are really great opportunities. And I know I'm excited to be part of those and really help develop the next leaders for our community.
I think along the same lines, I would say an important thing I took away from this is this importance of community health integration, whereby we're all part of the same ecosystem here. Something I do might unintentionally or intentionally affect somebody else in that ecosystem. And I think recognizing that is going to be really important. As the information age has gone, these silos have really come down, where collaboration and integration is going to be much more important. Similar to that, and building on that, with that integration comes the importance of data. For us to be able to make decisions and predict things that are going to happen in this city, I think having a great focus on what is the data showing, who's not counted in that data, and how are we going to analyze that data in a safe and equitable way is going to be really important moving forward. The other third theme I heard is this importance, and I think we all sort of touched on it, is workforce development and mentorship. For us to sort of teach the people that are going to take our jobs in a few years, it's going to be really important to serve as mentors and to connect folks who are looking to get into healthcare or in public health with great mentors. And one thing we do at UT is, we try to bring people that will serve as great mentors from across the country here to San Antonio to further populate UT with great educators and great minds. and diverse educators and diverse minds.
So 3 takeaways. I think they've all said it all. Just say it a little bit different. I think collaboration is important, not just amongst professionals, but to Dr. Huber's point, our communities. We need to be listening to what communities actually need versus us telling them what they need. And so maybe getting along with neighborhood associations, the small local nonprofits that are doing the work on the ground already, and working with them from small institutions all the way to the big institutions. And that kind of pervasive collaboration is important. Number 2, the data. We need to understand where our needs are, where are they the most, and where our interventions will be the most impactful. We know we don't have never-ending resources. And so we need to use this data to target geographically or patient populations, the ones that need it the most, so that we get the biggest impact and results from that. And so data science and sharing that information, and I have studied the South Bexar County report through and through. It is very interesting, but so that's important. And the last lesson I took away, which I think we're on the same page, is sustainability. And it means that once we have finished doing what we're doing, we need the future to take up the flag and continue working on these issues. And so that means participating in the education and fostering of our future leaders, and actually trying to entice them and show them and maybe target them where we need them the most. In vascular surgery, we talk about having a deficit of vascular surgeons to take care of our aging population, which many need vascular surgery. And what we've realized is that even though we may not have enough, even the ones that we have are all concentrated in a medical center, and very few are out in the community. And so how do we not only train our future, but how do we make sure, encourage them, and support them to work in the areas that really need? And so that kind of sustainability is important. So those are my 3. Thank you.
So we're going to have a giveaway and a takeaway. The takeaway comes later. That's a lunch outside. The giveaway is a hand of applause for our panelists.